1 week from today, on March 22nd, Kansas will move into the next phase of our vaccine distribution plan. In light of the news of an increased supply of vaccines from the Biden administration, we are going to combine phase 3 and phase 4 into a single phase. That means that Kansans with health conditions and those who work in critical industries, such as aviation and agriculture, will be eligible for vaccination beginning next Monday. We anticipate that we'll be able to move into the final phase for Kansans deemed to be at the lowest risk, phase 5, on an accelerated timeline, meeting the President's timeline of May 1st. This expedited timeline will allow Kansans to get back to work, get back to school, and get back to a more normal way of life. For Kansans wondering where they fall into this new schedule, phase 3 covers 2 groups: those aged 16 to 64 with serious medical conditions that increase the risk for severe illness from COVID, including cancer, Down syndrome, certain heart conditions, type 2 diabetes, other serious illnesses, and all pregnant women. And other non-healthcare workers in critical infrastructure who cannot work remotely, including agricultural and food workers not included in previous phases, workers performing in-person activities indoors, utility workers, social service and government workers not included in previous phases, logistic workers such as truck transportation workers and couriers, water and wastewater workers, shelter, housing, and finance workers, and information technology and communication workers. Now, phase 4, remember that we're combining these. Those aged 16 through 64 with other medical conditions that increase the risk for severe illness from COVID-19, such as asthma, cystic fibrosis, liver disease, type 1 diabetes, neurological conditions like dementia, and other medical risks. Given that the differences between phase 3 and phase 4 are pretty nuanced and difficult to discern, we decided to collapse phases 3 and 4 into essentially one phase. As I have said many times before, our biggest barrier to delivering vaccines has been the national shortage. If the Biden administration delivers on its commitment, we anticipate that we will finish combination phase 3 and 4 by late April. That's about 2 months sooner than we originally thought. As President Biden has said, if we all do our part, get vaccinated when it's our turn, and continue to mask up and socially distance in public, it won't be long before we can get our lives back to normal. Back to rituals and traditions like parades and barbecues on Independence Day, back to in-person worship services, back to ball games, and most importantly, back to spending time with our loved ones, whether they're near or far. Today, we're issuing this guidance 1 week ahead of its effective date and 2 weeks before we will see the significant increase in our supply. This heads up that we will move into both phase 3 and phase 4 next Monday will give those counties with vaccination events planned an opportunity to finish vaccinating phase 1 and 2. It will also ensure our local providers and health departments have enough time to prepare for the next phase and notify Kansans who will be eligible for vaccination during the combined phase 3 and 4. Today's announcement reflects the work the Kansas Department of Health and Environment and the Kansas Division of Emergency Management have been doing to prepare for the increase in doses that will soon come to Kansas. In February, I issued an executive order to ensure we have enough vaccinators to quickly vaccinate more Kansans. We will activate even more providers across the state, including our safety net clinics, pharmacies, hospitals, and medical practices. We'll partner with the federal government to set up mass vaccination sites in Kansas, significantly increasing the number of Kansans we can vaccinate each day. We're seeing all of these pieces come together. We're determined to get every Kansan who wants to be vaccinated as quickly as possible. I know we are all ready to resume our pre-pandemic lives, and we're getting close. If supply continues as expected, I have confidence that our state will move through our next phases and meet President Biden's goal, ensuring all Kansans are eligible for the vaccine no later than the 1st of May. I encourage all those who are now eligible for the vaccine to visit kansasvaccine.gov and use the Find My Vaccine mapping tool to locate a provider near you who has vaccines available. And with that, I'm going to turn it over to Dr. Lee Norman, Secretary for the Kansas Department of Health and Environment.
Thank you, Governor. My comments will be brief and rather unusual for me, actually. Normally, I like to have science moments and numbers, but today I plan on having neither. Mostly what I want to do today is just to thank and acknowledge everybody for what we've been through for this past year. This has been a very, very difficult time. I know professionally and personally, it has been an abundance of challenges. We talked about it on our tour about how we've had to be nimble and adjust as time goes on. This, for many people, and many people back there, I'm sure, it's been the hardest year of your career. And I know it has been very difficult for me as well, just because of the stress and strain and having to adjust. I hearken back to when I was deployed with the Army in the Middle East in 2017 and 18, and we had what we called a battle rhythm of how we ran our days and weeks and months. And the battle rhythm that we've gone through here, I think it feels very similar to that. With the arrival of the vaccine, I know we all have had a significant collective sigh of relief. There's still a lot of work to be done. This battle isn't over. We will continue that work well into the next months. One thing I think you need to do is take care of yourself and take care of each other. Resilience comes in many forms. I encourage you to step back and remember that at least where you started with you and your team and your family, because you've accomplished things that have just been monumental. It's important we reflect on the mountains we've moved. It's important to protect and to care for the people around you, your fellow caregivers. In the Army, we call them battle buddies, and this is certainly a battle that we've been going through together, and it's our buddies that help us get through it. We are in this together, and there is a light at the end of the tunnel. And Governor Kelly just addressed a big portion of where that light's coming from. So I'll now turn it back to Governor Kelly for questions.
Hey, any questions?
Yes, Governor, how much more vaccine is the state expecting to get that it can do this?
Well, we are expecting the biggest jump is going to be in our Johnson & Johnson doses. The first, in fact, the only week that we've gotten them so far, we got just shy of 24,000, and we're expecting right at 100,000 coming in the week after next. So that's the biggest jump, and then we'll continue to see relatively smaller jumps in the Moderna and the Pfizer.
Governor, some counties are still working for phase 2. Some counties are still working for phase 2. Wyandotte County in particular says they're still working to make sure that people in phase 2 are taken care of. Why do you think the state is ready to move into the next phase when there are still more people in previous tiers with no vaccination?
Okay, well, what we have seen across the state is there are some counties that are actually through phase 2, and we've been sort of holding them at bay before they move into phase 3. So we know that those counties are out there. We also know that given the amount of vaccine that we've had, that they have not been able to get all of those phase 2 people done as quickly as they wanted to. That's why we're giving them this additional week to go ahead and finalize the phase 1 and phase 2 as we move into 3 and 4. But remember that anybody from phase 1, 2, 3, and 4 will be eligible next Monday. Just because they're not in phase 3, they're in phase 2 doesn't mean that they can't still get a vaccine. They can.
Governor, you mentioned mass vaccination sites with the feds. Are there concrete plans as to how that's going to happen and where those sites are going to be?
No, those plans are in process right now. We're working with our federal partners to determine, how they're going to assess our need and then what type of mass vaccination center they would set up. There are all sorts of different things that they can do, from relatively small pop-ups where you might be able to do 250 people in a day, all the way up to running about 6,000 people through. So we're working with them now to determine what would work and what would fit best for Kansas. And we also, quite honestly, right now, until we get those additional doses of Johnson & Johnson, we don't have the need for those federal sites. But we anticipate when the Johnson & Johnson comes in and we get increased Moderna and Pfizer, we will need their help.
Governor, what proportion of the state population is taken up in this next combined phase?
Well, I know we had 1 million in phase 2, and that's a good question that I don't really have the answer to. Do you know?
I think between the two of them, I think they're right at 600,000.
Okay, Dr. Norman says when you put 3 and 4 together, you're right at about 600,000.
Governor, was it a mistake to not include cancer patients or others with fragile health in the second phase?
Did you ask me if other states did not include them?
If it was a mistake.
Sorry, was it a mistake for Kansas to not include them in the second phase?
No, I don't think it was a mistake. We followed very closely with the CDC guidelines in determining who was at greatest risk and wanting to get them to the front of the line. I'm very glad, though, because I know there's been some concern on the part of people who do have underlying medical conditions, that they're very anxious to get this, and I'm glad that we're able to move more quickly into phase 3 and phase 4 so that they can get taken care of.
Governor, actually this may be a question for Dr. Norman. Dr. Norman, I think you said this morning that the state is receiving between 140 and 150,000 vaccine doses a week. So am I hearing this right, that once the Johnson & Johnson vaccine starts to flow, we're probably going to see 240 to 250,000 doses a week?
No, we won't. That is the date that Governor Kelly is referring to, that we'll have a large increase in that particular week. We don't have any assurance from the federal government that that will be on a weekly basis. We will hear more as we get closer to that date. And I know you've read about the difficulty with production in the J&J.
But you still expect to get the underlying 140 to 150 a week?
Yes.
Okay. So I guess my question is, if you don't have any assurances that Johnson & Johnson is going to be able to come through in large numbers, how can you, it strikes me that that May 1st deadline may get pushed back.
John, I think in this situation, you just want to be prepared, and that's what we're doing. We're preparing by increasing the number of vaccinators we have around, by increasing the capacity for vaccinations site-wise, and then also, to have enough people to get those shots in the arms. One of the problems we can end up having is if we don't have enough people coming in to get the vaccines, if we've got all of these doses laying around. So we want to make sure that we can build on that capacity. If something happens and we have to pull back, we will do that, but we're not anticipating that. I think the president just announced that they bought another 100 million Johnson doses. So, yeah, we're dependent upon the production working, but given the guidelines that the federal government's sending down, we're pretty comfortable that we're taking the right steps to be ready.
Last question.
So we've got almost 1,100 vaccination sites now. How much will that ramp up?
Yeah, I'll let, he's got the detail.
Yeah, the question is number of vaccination sites. I haven't checked this week the number that have registered, but we were right at about 1,450 a week ago that were not necessarily all turned on and vaccinating because we didn't have enough vaccine to supply all of them. Yeah, it doesn't make sense to turn them on until we actually have vaccine to provide them.
Thank you.
They'd like to grab a